Okay, so I have Mr. Brown, age 50, status post is pneumonia. Patient has coarse breathing sounds and a lot of thick green secretions. Patient also has a weak cough. Patient is on 4 liters with the nasal cannula and SATs are 94%. Patient has been suctioned many times and will likely need more. Perform oral and nasal tracheal suctioning. What else can you do to help? We can give a mucolytic for the thick green secretions. I am going to gather all my equipment, which is my sterile gloves, my 14 French catheter, pulse ox, stethoscope, sterile water, cup, and lube. I'm going to knock on the door. Hi, Mr. Brown. My name is Terry. I'm with Respiratory. I'm going to wash my hands and put on my gloves. It looks like the medical doctor ordered some suctioning, a nasal tracheal suctioning due to your thick green secretions. Okay, I am going to let the patient know the hazards. One of the hazards can be hypoxemia, but I'm going to give you some oxygen to avoid that. I'm going to... All right, Mr. Brown, can you verify your name and your date of birth? I'm going to get some vital signs on you, put the pulse ox on, and listen to breathing sounds in 6 places. Patient has coarse breathing sounds. Oxygen was 94, respiratory rates was 18, heart rate was 90, color, patient is pink, no level of shortness of breath, and I am going to have the patient sit up in the sniffing position. I am going to pre-oxygenate Mr. Brown at 100%. And I'm just going to pull the nasal cannula down. And I'm going to pre-oxygenate for about a minute. Okay. And now I'm just going to get my setup ready. I'm gonna pour some sterile water. Okay, and I am going to open my sterile gloves. And I'm also going to set the patient on -120. Okay, I'm just set that on. It's on 120. Okay. Okay, I'm going to test this and make sure it's working. Put it in the sterile water. It's bubbling. And I'm going to lube up my catheter. Okay, Mr. Brown, we're going to go ahead and start this procedure. Okay, bevel upward. And I am going to proceed until my patient coughs. Okay, I'm going to draw back a little bit, but do not come out. Give the patient some time to breathe, and then I'm going to proceed. And then suction coming out. Okay. I'm going to pre-oxygenate my patient, and I'm going to also put on Mr. Brown pulse ox. Okay. And I'm going to listen to breathing sounds in 6 places. And also, let me go ahead and suction him. Okay, breathing sounds. Okay, patient sounds better. Oxygen is 95. Put the nasal cannula back on. Now oxygen is 95. Respiratory rate 18. Color, patient is still the same, pinkish. Heart rate 90. Level of shortness of breath, patient looks fine. I'm going to, hi Mr. Brown, are you feeling okay? You did pretty good. He's feeling okay. I'm going to give him his call bell. And if you need anything, just give your nurse a call. She'll be in touch with us. And I'm going to gather my trash. And I'm going to, of course, wash my hands and chart.